This presentation covers your thoughts as returned from both the feedback questionnaires and the worksheets after the collaborative working session in May this year. In that session, we had covered two separate but linked topics. One, to do with Newbury healthcare providers and your thoughts on its future, and two, on how and whether the 11 practices in Newbury should work more collaboratively together. In this presentation, I will first cover the demographics of the respondents, then how relevant they felt the meeting was, how they felt about collaborative working, and then separately about NHP, their views on the next steps, and then any other comments. The analysis is more qualitative than quantitative. It represents the views of a sample of doctors and staff working in Newbury CCG, and many of the questions were open, designed to generate views, so particular views in those questions are only reported when they are mentioned. Nevertheless, there was a minefield of different views which I would like to thank respondents for. I have tried to do justice to all your answers by giving full detail in the slides, but to make the presentation a little more succinct, we'll only talk through general themes observed. If you weren't at the meeting, I would strongly recommend looking at the YouTube presentations on NHP and collaborative working first. So, approximately 33 people had attended the meeting. 29 returned the feedback survey. 3/4 were doctors, the majority being GP partners, as shown in this pie chart. Practice nurses and managers formed the remainder of the group. The bar chart shows the age spread. 4 people didn't give their age. The remainder was spread from younger than 35 to over 56, with a slight skew to the younger age group. 27 people returned the worksheets, and again you can see the majority of responses came from doctors. However, there were more people who didn't specify their job role or age bracket. I asked you how relevant you felt the meeting and the topic was. This slide shows the majority. 70% of respondents felt the session was very relevant or relevant, the blue and red bars in this graph. You can see a breakdown by age, and generally younger respondents marked the session as being more relevant than their older counterparts. This is also shown in this graph, looking at the average response to relevance, again broken down by age. Respondents who didn't state their age also felt the meeting was less relevant. So, collaborative working. I'd asked your views on the opportunities and threats associated with the different ways general practice could be structured. Either as a GP network, a federation, a merger, a primary and acute care system, or keeping the structure as it is, status quo. I've broken this down to examine your views on their effects on the business, the service, staff and resources, and people's perspectives. It was an open question to allow free thought and comment, and to analyse your views they've been collated into common, unprompted themes. However, as they were unprompted, not everyone commented on each theme, and as a result, responses for each particular view may seem small. From a business perspective, you felt the benefits of GP networks included resilience, from being able to pool resources, which was the most commonly marked opportunity, improved capability, and an improved ability to recruit. It was also felt practices could maintain their autonomy. Problems included being complicated, increasing competition, and limited ability to compete with other businesses. As we move from this model to a federated model, and then onto a merger, more people mention increased capability, benefits from shared training, and better recruitment. New comments include decreased variation in the quality of the service and, as you move on to a merger, increased resources and an easier ability to commission services. However, autonomy was increasingly viewed as a threat. There were very few comments received for the primary and acute care system. One person marked an opportunity as more resources. Threats were increased regulation and less autonomy. Our current structure, status quo, received most aggregated comments. The opportunity was increased autonomy, however there were more comments about threats. 5 mentioning recruitment problems, 3 increased competition, and 3 that our current model is simply not sustainable. Funding and resource issues were also identified as a problem. Other comments included limited scope to develop the service and a need to improve globally. This slide shows your views on the different models' effect on services. Threats are on the left of the graph and opportunities on the right. The legend on the right shows the colours representing the different models. Of note, most people mentioned merging as the best model for improving access, followed by federating and then GP networks. Status quo was mentioned as the greatest threat to access. Continuity was best in status quo, or a GP network, and least in a federation or a merger. More people felt a GP network would provide a better choice of service than a federation, and that a PACS model would be the greatest threat to patient choice and undermine current developed services. Patient experience was felt to suffer in a merged model, PACS, and with status quo, with increased anonymity in a federated or merged model. GP networks and federated models were felt best for providing better out-of-hours and seamless services, federations and mergers for providing community services. This slide shows your views on the effects on staff. Opportunities are on the top and threats below. More people stated staff quality of life would improve with a federation model compared to any other model. The purple, status quo, was felt to reduce staff quality of life. These views are reflected in markers such as workload, peer support, and the opportunity for staff to develop themselves. By contrast, there were concerns antisocial hours might increase in either a network, a federation, or a merger. PACS received most comments for increasing stress and decreasing job satisfaction. It also received comments suggesting it might reduce job security, whilst a GP network received the most comments for improving job security. These views can also be seen here, with the GP network being the most favoured model and PACS the least. The GP network was also viewed as the most acceptable model to move to initially, with a federation and even more so a merger being just too soon. There were mixed views on how the public may perceive the different models, with comments here suggesting there may be suspicion of change, especially a merger, from older patients and loyal staff, whereas younger patients wouldn't mind change if services were responsive. The second question on the worksheet was also an open question. It asked what work you want to keep within your practice and what work you wouldn't mind sharing. This slide shows your views. The graph on the right representing items you had wanted to share in green, and the graph on the left items to keep in blue. Again, there were many comments and varieties in opinion. Some people wanting to share everything are seen at the very top of the right-hand graph in green, others to keep all practice staff and many of its current functions. Looking at this in closer detail, here we see your views on which patient-facing services you had wanted to keep or share. In blue, items to keep included core in-hours GP provision and access. There were mixed views on whether to keep extras or not. Items to share in green included 7-day access, extended hours, and specialist and community services. In terms of backroom function, a majority felt many could be shared. 17 mentioned policies and protocols, and 10 HR. There were mixed views on whether payroll, audit, and recruitment should be shared. Many also felt training and education and the more specialist services of strategy and bid writing should be shared. In staff and resources, 5 people specifically mentioned being in favour of keeping reception staff. Less were in favour of keeping administration staff or the practice manager, possibly reflecting the previous slide's views about sharing backroom functions. However, 3 people mentioned wanting to keep all practice staff and 2 specifically mentioned clinical staff. Resources such as premises and especially the patient list were mentioned as items to keep. Comments favoured sharing locums and cover arrangements as seen here in green. There were only a few comments on public perception, with views split on whether the public will care about any change, or whether they would prefer their own GP, own reception, and own GP's access. So, coming back to a general overview, in the green on the right, you can see that most comments were in favour of sharing backroom functions, training and education, specialist services such as bid writing, and what might be perceived as extra work such as extended and 7-day working. In the blue, on the left, comments also favoured keeping core general practice, much of current practice staff, recruitment and access. When asked specifically about which model the respondents preferred, the majority, 12, preferred a GP network, 6 a federation, and 4 status quo, with federating being the most popular in those under 35, GP networks most popular in those between 36 and 45, and status quo in those over 56. So the crunch question is, do we want to collaborate more? This bar graph shows your responses. The blue bars representing people who are very keen, going through to red, green, purple, and then turquoise for those who are not very keen. The line graph in light brown represents the average response, and the closer to the top, or to 1, that the line gets, the more keen the respondents are. The further down to the bottom, or to number 5, the less keen. On the left, in the bar graph, you can see the total responses, which is then broken down by age on the right. The graph shows the majority of respondents to this question, 58%, the blue bar in the graph, were very keen for more collaboration. 81%, the blue and red bars, either very keen or keen. The response does vary by age, as seen by the line graph. Respondents not stating their age were less keen for more collaboration. Coming to your views on NHP, the top graph shows your thoughts on the purpose for NHP. 11 people wanting to use NHP to collaborate, to provide services, 9 to share back office function, 9 to give practices the ability to bid for contracts, and 6 to keep it in reserve for a future use. The graph also shows how views differ across the different ages. The bottom graph shows what projects you had wanted NHP to move forward on. There was a similar response for all the options, with the locum service being the most popular, followed by the HR legal package, bid capability, and then the NHS health checks. This slide shows your response to which structure you favoured for NHP, and the most favoured option here, in pink, was collaborating for an operations manager, voted for by 8 people. 3 wanted to suspend NHP, 6 to either keep NHP as it was or streamline NHP, 3 to delegate projects to practices, and 5 to invest in an operations manager. No one expressed a wish to disband NHP. To end, I'd asked open questions on your thoughts for what we should do as the next steps. As you can see from this slide, there were many suggestions. For collaboration, the most agreement was on sharing back office function. This was followed by instituting structural changes to link practices closer together. For NHP, again, the most suggested option was sharing back office function. This was followed by building up social relationships between practices. This slide combines those last two graphs, and the question is, could NHP be used as a tool to collaborate further? The next few slides show all your comments as received, and I'd like to use them to form the basis of my conclusion. The first thing I should say is that the numbers from this survey are small, so it is more a qualitative study, indicating views of people who came to the meeting, rather than stating the more general, wider feeling in the CCG. It does indicate, as shown by the comments on this slide, that some respondents are concerned about the difficulties facing general practice, and feel there is an urgency to act. This is about survival control. We need to address this, otherwise PAYE is upon us. It also shows differences in opinion, across and within age groups, with some uncertainty about change in general practice and about NHP, preferring to maintain things as they are. still unsure of NHP purpose, would be reluctant for anything that would take power away from our GP partners, as I feel they are great employers. Others trying to find practical solutions to solve the concerns of competition, workload, and recruitment. The results suggest that there is a significant interest in collaborating more, possibly through NHP, possibly by sharing resource. However, as the comments on this page recognise, there is apathy and disinterest. Engagement is needed if, as the comments on this slide suggest, we want to be more ambitious and proactive. So some of the comments here: we need to be careful not to estrange practices, but we need to move forward in an inclusive way and not wait. I think GP partnerships need to be ambitious about the future to ensure they are poised to compete for primary care business. I hope NHP gains momentum. Let's be ambitious. So to end, I'd like to thank you for all those that attended the meeting, for your time, your responses. It would be interesting to repeat a similar survey across a wider patch, maybe with more time for discussion. And I agree with the comment on this page that in Newbury we are, at the moment, in a very strong position as a group of practices. That may be a double-edged sword, as though that's often the best time to consider how healthcare is changing and how it would be best delivered in our area. It also decreases that need and desire for change. And if we want to work more closely together, we need more than engagement. We need commitment of time and resource. So, we've assessed the viability of NHP, we've explored the possibility of collaborating more, reviewed your immediate feedback to the presentations. The decision now rests with you. Thank you.